I ngā mana, inga reo, rangatira mā, tēnā koutou katoa, ko Paula Tesoriero tōku ingoa. I'm the New Zealand Disability Rights Commissioner. Nau mai, haere mai, welcome to this Facebook Live panel discussion. We're here this evening to help you understand more about the vaccine and why it's important to get vaccinated. We know that many people are hesitant and have questions that they want answers to before making the decision to be vaccinated. That's why this evening we have 4 experts who are here to answer the questions that you have. We will do our best to make sure that this evening we can answer as many questions as possible. Before I introduce our panel, please note that this FaceTime session is being recorded and will be available after this evening. Now, let me introduce our amazing panel. We have Dr. Anthony Jordan Ngāti-Wai. Anthony is a physician, clinical immunologist and allergist who treats patients with disorders of the immune system. He is a member of Te Ropu Whakakaupapa Uruta, the National Māori Pandemic Group, and sits on advisory and governance groups for the Northern Regional Health Coordination Centre. Secondly, we have Dr. Hina Lutui. Dr. Hina is a South Auckland-based GP and clinical director of the Alliance Health Plus network of primary healthcare organisations caring for more than 100,000 Pacific and high needs patients. We also have Dr. Huhana Hiki, MNZM, Ngāti Tahinga Whakatohea. Huhana is a scholar of disability research and legal theory who has a long-standing interest in the human rights of people from marginal backgrounds. Her goal is to increase the knowledge, profile, and inclusion at all levels of society of Indigenous people with disability. And our 4th and final panelist is Jackie Marriott. Jackie is the vaccination director for the Whakarongoro Aotearoa COVID-19 vaccination healthline, which offers phone, email, and text support for and by disabled people and people living with impairments. So, as you can see, you have 4 experts who will be answering any questions that you have, or as many as we can get to this evening. We've had a lot of questions already come through Facebook, so we'll do our best to answer as many as possible, and you can also send questions through. Before we get started, I want to ask each panelist if you can tell me in 30 seconds or less why you chose to get vaccinated. And first, I'm going to go to Huhana.
Kia ora. Kia ora. The reason I got vaccinated is simple. I have mokopuna, I have whānau that have disabilities, and I want to see them make it through and have a good life. Without a vaccination, I know that we would see more decimation among Māori, among our Pasifika whānau, and especially among our most at risk. And that's why I'm fully vaccinated. I've had 3 jabs. I'm waiting for the booster, and why I'm hoping we can get as many people vaccinated so we can keep living a good life, one that we all want to have. Thank you.
Kia ora, Huhana. Anthony.
Tēnā koe, Paula, thank you very much. The reason I got vaccinated is similar to Huhana. I want to protect my whānau, I want to protect my iwi. Protecting myself is in there too, but looking out to my community and showing that I trust in the vaccination, what it offers me and other people in terms of enabling our healthcare system to continue to deliver healthcare in times of pandemic, which has been really tough for a lot of our disability community. All those other things beyond just vaccination have been harder to access. And so that's my contribution to society and to the whole overall healthcare system. Kia ora.
And Jackie, why did you get vaccinated?
Kia ora, thanks, Paula. didn't occur to me not to get vaccinated. It was one of those no decisions, if you like. I've worked in health for over 35 years, and was a natural step for me to go and get vaccinated as soon as it rolled up. A little bit like Doctor Who, I'm up to my 3rd vaccination, so I've had the booster shot, and it's all gone well. It's gone well. The other reason I mostly got vaccinated as well was I've got older people in my family, and some of them aren't very well, and I didn't want to expose them to COVID and put any pressure on them at all. So that's why I took the vaccination shots.
Kia ora, Jackie. And Hina.
Kia ora. Mine was purely selfish reasons in the beginning, to be honest. I love my job. I love serving my community, but I don't want to get sick from my community. And so, when they shut the borders, I was happy. I'm like, I ain't getting COVID if it ain't coming into the country. So when I heard that we had a vaccine, I was like, hallelujah, praise the Lord. There is something that's going to help keep me safe, stop me getting sick from my patients or from other people or my whānau and stuff, so that I can keep serving the community that I love. So that's why I got vaccinated.
Malo, Hina. I'm not sure I can top that, but why did I get vaccinated? So I got vaccinated because as a person who is asthmatic, I really thought it was important to make sure that I looked after myself, but most importantly, like others, it was really about family and community. So my children's grandparents are older New Zealanders, and I wanted to make sure we were looking after them, and in particular one of my parents who is in an aged care residence. I'm very conscious of that responsibility, and also I have a 9-year-old son who, like other children at this stage in Aotearoa, the vaccine is not yet available but coming soon. And for my community, as the Disability Rights Commissioner, I meet with many disabled people all around the motu, and many have compromised immune systems, and I wanted to make sure that I was doing all I could to protect our community. So in short, yes, partly about my health, but mostly about my family and whānau and my community. So thanks, team. We're now going to start rapidly getting through as many questions as we can. I'm going to start with some that have come through the Ministry of Health's social media channels. The first I'm going to ask, and I'm going to ask you, Anthony, to answer this one. If you are undergoing immunotherapy and are fully vaccinated, are you at a greater risk of infection should you be in contact with someone unvaccinated who has symptoms of COVID?
So that's a really good question. So immunotherapy, I like to think of it as things that suppress the immune system. So things like chemotherapies can be considered immunotherapies. And then there are other types of immunotherapies like allergy therapies that don't suppress the immune system. So thinking about people who have suppressed immune systems, they are at more risk of suffering both worse outcomes from catching COVID, and they need an extra dose to be able to get the high level protection when they're vaccinated with the COVID vaccination. So we encourage them to get vaccinated because we know they need it, and we give them an extra vaccination because their immune system needs that extra boost as well.
Thanks, Anthony. Next question I'm going to send your way, Hina. If you are fully vaccinated but have a chronic illness like Alpha-1, should you get a booster shot, or would it be advisable to just stay away from unvaccinated people?
The short answer is yes. I would recommend getting a booster vaccination because studies have shown so far overseas that 3 is better than 2. And we want to, so when people have got chronic disease like Alpha-1 or any other chronic medical conditions, we know from the studies from overseas that these people are more likely to become very sick and unwell if they catch COVID compared to people who don't have these medical conditions. And vaccines help us to boost our immune system, our own fighting cells that help us to get rid of infection when it comes on upon us, to help boost that so that we can fight off these infections and disease when we don't have such good treatments for it. And so for these people, I would highly recommend getting the booster vaccine.
Kia ora, Hina, and while I'm with you, someone's asked, can you get it, the vaccine, if you have seizures?
The short answer again, yes, definitely. There is no reason that you should not get the vaccine if you've had epilepsy or have had seizures that I can see in the evidence so far. So yes, get the vaccine.
Malo, I'm going to ask some questions that people have sent in around children. We know our tamariki and rangatahi are incredibly important, and so people are taking their time to think about the vaccine. We're going to ask you, Dr. Huhana, first, what are some strategies for talking to my child who is anxious about vaccination and nervous about needles?
Well, that's a normal thing. I can tell you at my age, I'm still nervous with needles. Even with this moko kauai on, I still get nervous. With children, and what they've done with some of the areas is they've had sensory spaces for people that are nervous, that need to have a quiet space and a little bit more time. So there's actually been a lot of sensitivity around people who are needle phobic. I know a few that have ended up being sedated. They've gone into hospital to have the vaccine. A few people very scared. They've actually taken time out. And that's actually really amazed me, is how the vaccinators have taken time out for children, for people that are very nervous or have got autism or some other disability that makes them react badly. They've actually gone and made a huge effort to ensure that they have the right environment, that they slow it down, that people feel safe and feel happy. So you can distract. There's a really good trick to it also. You talk to the child, don't talk just to the parents. When you relate to the child, they'll start talking to you. You could do something like sing to them. You talk to them about something they love. You tell them what you're doing. Don't ever lie to a child, especially with an injection. And what you do is you might do some sensory desensoring. So you might touch their arm and say to them, how does that feel? Oh, look, this is what I'm doing with a pen. That doesn't hurt, does it? And then you could start distracting them with other ideas, talk to them about something they love. And that has often worked. When it's gone very bad, they have sedated a few of the autistic young people that are too nervous. And that's worked very well for them too. They've come out of it without trauma. So it's just so important. 1, communicate with the child, age friendly. 2, distract them as much as you can. 3, make it fun. Do something with a balloon. Do something that you're good at that the child will enjoy, and you'll find it a lot easier, especially when we're going to start doing vaccinations on younger children. We really need to be able to slow it down, have time with them. It's not something you rush. But if you take that time, usually you'll find it turns out quite well.
Thanks, Hu. I know, I myself really don't like needles, and growing up I had, like many disabled people, lots and lots and lots of surgeries, big surgeries. And my mum used to always say to me that the thing that upset me the most, or the most I was worried about, was actually having the pre-surgery needle more than the big orthopedic surgeries. And a couple of things that used to work for me was I always took a little teddy bear with me through all my surgeries, and they also had the injection, and I then felt responsible for looking after them. And it sort of, like you said, distracted me from worrying about getting that jab myself, and I was focused on my little teddy bears. And so that was a strategy that my parents used, and really comforted me during some of those really big surgeries. There's another one about...
It works really well, actually, especially with children going through chemo.
Yeah.
It works very well. You'd be surprised how many young children get a lot of needles in their lives. So it's not something that's unusual or rare. It's quite common. And we need to just do things like that. The teddy bear idea is brilliant.
Yeah, absolutely. Kia ora, Hu. I'm going to ask you, Jackie, this next question. It's still on children.
Mhm.
This person says, I'm worried about vaccinating my disabled child, and this might impact on their impairment. Isn't vaccinating the rest of my family enough?
Oh, I don't know if I can answer that question.
All right, I'm going to ask one of our medical doctors, Anthony.
I'll jump in there. Vaccinating your whānau is a really important part about protecting those people who have yet to be vaccinated. And I think you had mentioned that, Paula, about part of the reason why you got vaccinated. But when the vaccination is then offered to children who can be vaccinated, you're doing another level of protection. You're protecting them even more than you were by just protecting those around them. And we know that because at the moment what we're seeing is that, you know, educational settings, being out and about, people are picking up COVID. So it's not just about what we can do with the whole community, but you do need that individual level protection as well. And amongst our disabled community, there'll be a lot of people that have other conditions that put them at greater risk than if than, you know, other age-matched, you know, children, and they may not suffer the same sort of illness. So I think when people say it's mild in children and all of those other things, we need to recognize that actually that may not be the situation that we're dealing with the children who have a disability as well. So contextualize it for your child.
Thanks, Anthony. That's really helpful. I'm going to stick with you for a little bit, Anthony, and ask you some questions about allergies and autoimmune issues. So the first is, I have heard that I shouldn't use the Pfizer or the AstraZeneca vaccine because I have a high allergy risk, or it might cause a flare in my autoimmune disorder. I don't want to end up in the hospital. Is this true?
So the first thing I would say is that in general, people with allergies are not allergic to the vaccine. That's a general statement. When we originally rolled out the vaccine, there was this talk about if you've had allergies to foods and things like that, that you need to wait a bit longer. But actually, that's not a concern. Lots of people with food allergy, lots of people with allergies to other medication have successfully taken this vaccine, and that's what people should be reassured about. The other thing is around autoimmune conditions. A lot of people with autoimmune conditions are on medications that suppress their immunity, and they should be encouraged to get the vaccination to protect themselves. And actually getting sick with COVID is much more likely to cause a deterioration in your conditions than getting the vaccination ever would.
Thanks, Anthony. The second question, sticking with you, is I have underlying allergic conditions, multiple drug allergies, previous anaphylactic reactions, mast cell activation disorder. Is it safe for me to get vaccinated?
Yeah, that's a really good question. So one of the things that I deal with are people that have mast cell activation syndrome, and we can use medications and vaccinate people safely. We tend to do it in an environment where they feel safe, because actually what we know is these people have had really bad experiences when they've had medications before. So doing it in a supported environment where they know people are there that can make sure that they're fine is really important, because actually that's what they want. They just want reassurance they're going to be okay.
That leads nicely actually into this next question, which I think you've partly answered, but for people who are taking immune system suppressing medication or have an autoimmune or auto-inflammatory disorder, what are some of the things they should consider when making this decision?
That's a good question, and there's so many answers to that, because everyone may be on a different medication. The timing of the medications may be different. The general rule is for the majority of these people, they need to talk to the person who's prescribing their medications to work out the optimal timing of their vaccination, and also looking at that third dose offer to make sure that they get the protective immunity that they need.
All right, thanks, Anthony. I'm going to move to some sort of, I guess, non-clinical questions, but really important questions about access and transport and some of those things. I'm going to start with you, Jackie. The first question is, how do I know which sites are suitable for someone with a particular disability? I've heard about people booking vaccinations at places that are supposed to have certain access arrangements, but then they got there and none were actually visible. Who can I trust?
Nice, good question. So there's a couple of pieces to this question. So when you go online to book your vaccination, when you put in your location, it will drop down a number of different sites, vaccination sites that are available. And within those, it's listed the accessibility or special considerations that might be at that vaccination site. The other one is when you call the Whakarongo line, the 0800 number, and push option 2, you can talk to the team, and the team will go online and have a look specifically to find a site that meets your needs, because it might not be as easy to find it when you look online yourself. So the team can work with you, they can take the time, and even other times they've rung ahead. They've taken the opportunity to ring the VAC site and ask, have you got this? Can we arrange this? This is the situation. These are the people that need to come in. So they've been really, really supportive of trying to get what it is that they need to have undertaken. And the last question that you mentioned, what was that? What did you just say at the end of that, Paula?
Oh, it was, who can I trust?
Oh, okay. You can trust us. We've got lots of information, and we've worked very well with all the different vaccination sites. The other thing I wanted to mention is the VAC sites are actually really, really helpful. So if you're unsure when you arrive, get in contact with them, send someone in ahead of you, or talk to someone outside, and they'll bring one of the nurses or one of the staff out, and they'll really try and make it as most positive experience as possible. Because they really want to support you to get in there to have that vaccination.
Nice. And Jackie, and Huhana, you might have some information on this. What about people who can't afford to get to a vaccination centre? What are the options?
Oh, I can help you with this bit, and who you might be able to add to this. So the government's funded a transport option as well. So if you ring Whakarongo, they have a team of people who will arrange transport for you, and it's fully funded. So we have a team of people that work with a large number of providers around the country. So you can be anywhere, and we'll do what it takes to get you there. We possibly won't do, like air transport, but anything that's kind of road or water based. I got an invoice the other day for water taxi. So we do that. We meet the needs of what needs to be done. You can be rural. So there's no limit. I'm not saying you can be in Nelson and decide you want to be vaccinated in Dunedin. That's possibly not going to happen. But we can arrange it so that you can get close to a vaccination site from where you live and support that.
And I'll just add to that there is, I read actually an article this week where this guy is the most remote person in Aotearoa, and it takes him, I think, 2 days to get out of the bush to get anywhere into the town, and he hadn't been out for 6 months. He comes out about every 2 months or so, or every 6 months, and he's vaccinated. So I mean, there is no excuse for this. They've even accommodated people who can't leave their home, who are too sick or too unwell, that vaccinators have gone to them as well. So and there's also now a text number for deaf people to be able to communicate. It took a while, I have to say, but it's really good that we've got it now. So if the Ministry of Health can put that up on their page, that would be fantastic, because it's so important that people can access in whatever way they need to communicate. And that's actually happening. I think you've got it in Easy Read, you've got it in NZSL, you have it in plain language for people. So even if English is a second language, that Easy Read version is very good for them as well, because it provides an easier way of understanding the vaccination process.
Thanks, Huhana and Jackie. I'm going to take a couple of questions that have just come in now. One is from Catherine, and I'm going to direct this to you, Hina. What if you have a history of DVT?
Oh, the good news in New Zealand, we have the Pfizer vaccine. And so that with an increase in DVTs, whereas the alternative may have some evidence for some people, but it's not really strong, the AstraZeneca. But my option for you then would say, please take the Pfizer vaccine, which is also the vaccine that we prefer here in New Zealand because it has got the most evidence so far and showing good results in both efficacy and safety profile.
And Hina, I might stay with you if I can for this next question from Megan, who says, why are we only promoting the vaccine as the only thing to protect you? Why is there no narrative about improving health? Do you want to start on that, and others can build on it if you'd like to?
I mean, I guess we work in the health industry, so we're constantly talking about health in general. And at this stage, because we're in a pandemic, you know, this is a disease that's sort of new to us. We haven't had a lot of natural immunity or natural way of fighting off this infection. That's why we have a vaccine. Vaccines help us to boost our immune system, our own fighting cells that help to fight infection, so that if we come across this virus, we have a better chance of fighting it off. And that's what vaccines do in general. So vaccines are not new to us. A lot of us have been vaccinated when we were in childhood. We've had the measles, mumps, rubella, hepatitis, polio, tetanus. So a lot of these diseases have been helped to be suppressed or prevented by being vaccinated. There is no 100% perfect vaccine. There's no 100% perfect medicine or medication. But this is one of the tools that does help us to be able to keep ourselves well if we come across this virus. All those other things like being healthy, eating well, exercise, those are all good things we should be doing all the time to keep us well and prevent us from getting chronic diseases like diabetes and the such that are caused by lifestyle changes. But some of us, unfortunately, we were born with things that we can't help that makes us more vulnerable to some diseases or not being able to fight off infections so well. And so vaccines give us that opportunity and the chance to be able to do that. Thank you.
Thanks, Hina. Anthony, do you have anything you want to add to that?
No, Hina's kind of covered it. I think people should look as vaccines as an and, not an or. Don't think about not taking care of yourself as an alternative to being vaccinated. Think about doing both things. They're both designed to keep you well.
And I might just stay with you, Anthony. A question from Angeline. Is the adult vaccine okay for a 12-year-old that has not yet started puberty?
Yes, so it's a really important question. A lot of people have asked about whether or not vaccination impairs the onset of menstruation or interferes with any sort of development through puberty, and there's no evidence that it does that. So yes, the adult vaccine, the adult dose for a 12-year-old is appropriate.
Thank you, and thanks, Hina, for your answers. I'm going to come back now to some of the questions we had in advance of this evening, and I'm going to come to you in the first instance, Huhana, which is some people believe that vaccine injuries or severe side effects are common. How do we go about having conversations with these people? This is, people who might be hesitant. How do we have those conversations?
Well, I think we need to be able to listen. It's really important. I had someone actually approach me recently, a couple of weeks ago in my private messages, and we had a conversation. They were scared. So I asked them what they were scared about. hear what they've got to say. We broke it down. So one of the things is a lot of misinformation is out there, but there's always a bit of truth behind that misinformation. So what I've discovered is that if you break it down, you start to find out where the truth breaks away and the misinformation comes in. And I was actually able to help this person, and their whole family are now vaccinated as a result. I think it's really important that we have conversations instead of trying to avoid them, as some people try and do, because I don't discuss it on social media. That's not the place. But when you have a really good conversation one-on-one, you can actually break down all that rubbish that goes on around you and really break down what's going on. And it does work. I've seen a few hesitant vaccine people now go ahead and get vaccinated after having conversations with them. And it's just being honest. Vaccines aren't 100% perfect, but what also some people forget, or this younger generation, and I hate to say that because I don't want to divide between the oldies and the youngies, but I was of an age where I didn't get vaccinated as a baby, and I was at an age where I actually had friends that were deaf and blind through rubella and through other forms of diseases that no longer exist in childhood anymore. And I was shocked in 2019 when we saw measles return to the way it did in South Auckland. And I've never seen that. For anyone that's had friends that have got polio, that have had these results from these diseases, you don't hesitate getting vaccinated. But because we've got 2 or 3 decades where we've been doing this, a lot of people don't see or understand the danger of leaving these diseases to grow. And so it's very important. So I talk to people about what it is that they're worried about, and again, like the healthy lifestyle, that is not I've got friends recently that had a disabled Māori mother with 2 beautiful young daughters, all got COVID recently. Because mum was fit and fully vaccinated, because she encourages her children to be exercising, like swimming and that, they went into hospital. Mum ended up fine. The 2 girls had a struggle because they're too young to be vaccinated. They're okay now. But because of mum's stand, healthy eating, exercise, and vaccinating herself, she managed to save the life of herself and her 2 children. That's how simple it is. So you don't need to put aside unhealthy, healthy eating, healthy lifestyle during a pandemic. But at the moment, the priority is to get vaccinated and stay as healthy as you can during this time, because it actually stands in your favor if you do get COVID rather than against you.
I'm just going to come back to you, Jackie. I just want to explore a few more of the practical sort of questions that people have been sending in around how I get there, who pays, how do I go about getting a vaccine. So I want to ask you first. Someone says, I'm not able to leave the house, so I really want to be vaccinated at home. But last year, when I asked for someone to come home, it wasn't an option. Now I hear you have to pass some kind of test before anyone will consider coming and vaccinating you at home. What am I supposed to do?
So we can absolutely help with that. So call the 0800 number. We can arrange for in-home vaccinations. So I'm not sure that it wasn't able to be done previously, but definitely it can now. And so there's a fantastic team of people that will come to the house and provide those vaccinations. There's no cost. We just need to book it in, and the public health people will get in touch and arrange the right time that suits you, and then slot you in and get that vaccination undertaken.
Great. Hannah, you might want to make a start on this, and then Jackie, you might have some things to build on it. Someone says, and we know this can be an issue in our community. I've had really bad experiences with transport services, with drivers who don't have a clue how to get me safely into their vehicle or make sure I'm not in pain during the journey. How can I be sure of getting a trained driver who understands my disability? The vaccination experience is enough without a bad experience of getting there and back.
Some of this comes down to some self-advocacy here. If I know that there's a particular driver and company that I prefer to be with, then I will talk to the team at the vaccination centre, and I will actually ask them and say to them, it is for safety and the fact that I feel better if I go with, say, Driving Miss Daisy or, Rely on Us or the Auckland Cabs, rather than these other guys. I know this guy, he's agreed to take me, and so I'd prefer to go with him. I don't think that'll be a problem, but Jackie can confirm that. But some of this is about self-advocacy. If there's something you need that's particular to your need, then argue for it, fight for it. Just say to them, no, I need this because my disability means that I have a limited, ability, and I'm in a lot of pain. So for me to get to you, I need you to help me with that. Otherwise, can you please get someone to come to me? That's the alternative. If it's too hard to get there via public transport, have a talk to them, as Jackie said earlier, and see if they can actually come to you. Because it is difficult for some of our community to actually get out of the house and to safely get from A to B.
You're totally right, Dr. Huhana. So we can provide, or we will certainly have the conversations with the provider that you're most comfortable with and that you're most familiar with to help you get there. But of course, absolutely, if it's really too difficult and you don't want this whole experience to be unpleasant, and if we can arrange the coming to your home, we will totally do that, and we'll just make it work, because sometimes it can be tricky.
Thank you, you both. This other question before we circle back to some more clinical based questions, and Huhana and Jackie, you might both have something to say on this. I would like to talk to people who understand where I'm coming from as a disabled person. Is there someone who understands the kinds of issues disabled people and people with chronic health conditions and long-term impairments have to deal with every day? Huhana, do you want to start with that?
Well, I kind of hope I do. And I've had quite a few of the disability community talk to me where they've had concerns, and I've actually tried to help them to break down those concerns. But go to somebody you trust that and I've said this to everybody, if you know someone and you feel safe talking to them, then talk to that person. It doesn't have to be your doctor. It doesn't have to be, anyone. It might be a nurse, that you feel safe and comfortable with. If you need to contact me, just private message me. Most people know how to find me on social media, and it's just so important. Talk to people and flesh out what it is that you're concerned about. I absolutely get it. And I'll be honest here, I had no intentions of having the vaccine at the beginning of the year. I'd heard about the AstraZeneca. I don't want blood clots, and I'm high risk for them because I'm not very mobile anymore. And then I saw they were going to do the Moderna, and I thought, oh, no. And then Pfizer came. So I read up about it, and I know a little about that type of vaccine. And I felt really happy because it wasn't the same ones where people have concerns around certain ingredients. It was actually, it's a brand new type of vaccine, or it's been out for a wee while, but it's still within that newish family, and it's a heck of a lot safer than others. So I did some proper research, as I have a research background. I didn't go to social media or Google Doctor. I actually went and grabbed peer-reviewed science journals and read through and made my decision based on that. That's me. But if there's somebody that can easily find that kind of knowledge and you trust them, talk to them, because no one knows your disability more than you, but no one understands it better than the people that you can trust that can help you go through your concerns.
It's all about having people who you trust, isn't it? Who you trust to help you make a decision, and might be a useful sort of moment just to highlight the Personal Advocacy and Safeguarding Adults Trust, who can work with disabled people nationwide who might require help with their decision around whether or not to have the vaccine. And that includes specifically people with learning disability, neurodiversity, or cognitive impairment. So you'll be able to find the contact details for the Personal Advocacy and Safeguarding Adults Trust on the ministry's website as well.
And also, it's important to know that a lot of our community groups, such as CCS Disability Action and others out there, have been advocating for our community to have access. They fought for us at the beginning not to put DNRs, do not resuscitates on us if COVID lost control. They've been advocating for us right from the beginning. And so, you know, those are the groups. If you don't feel that you can advocate for yourself, ask them to help you. They'll reach out. Your total membership, where you're a member of, you've got Parent to Parent. They've got some very good voices within there around parents of disabled children that have the knowledge behind all of this. But in all honesty, I will say this: is it more that you're worried for yourself? But if you're a parent of a disabled child, you do have a big burden on your shoulders. That is the life of that child, and you'll do everything you can for that child, and I'll encourage you to do that. If you're very unsure, I've got friends that have lost their disabled children this year to the RSV, and it's extremely painful for them. Now, if you are worried about the vaccine, I'd be more worried about that child's life. So talk to somebody that has that knowledge so that you feel safe and secure in making that decision for your child.
Kia ora, Hu. Okay, I'm going to move to Anthony and Hina and ask some clinical questions that have been coming through. And I'm going to ask these in a fairly rapid fire way. So the first is from Renata, who says, this might be a question also for the Ministry of Health, but are our disabled tamariki going to get priority access to vaccinations?
So that's probably a very tricky question for Hina and I to answer, because
Yeah.
we don't actually contribute to the decision around sequencing of vaccines or prioritisation of vaccines. And I can tell you, so far, those decisions haven't been reached around 5 to 11-year-olds. And we're very mindful of what happened the last time we made a decision around sequencing and prioritisation. So both the ministry and all of us on this call are very mindful of what we do when we make decisions like that. So my view of it would be we provide access and delivery to all those who need and want to be vaccinated, because we have so many systems in place now, like we've been talking about, to provide vaccinations to people when they need it and when it's most convenient to them. Different to when we started last year, where we had limited supply and capacity to deliver vaccines. We're in a much better place now not to have to go through that again. And I really hope we don't see that happen again.
Thanks, Anthony. The next question is from Georgina. How many booster shots will we need?
Tricky, really good question. You need one so far, and let's just get over that hump. I think obviously we're seeing the development of new strains. So at the moment, people are talking about Omicron. So we're thinking not just about a booster of the same vaccine, but will we need to change the vaccine? So that boosters may be a different thing. Think of it like a flu vaccine, that we may need to change the strain year by year. The one thing I would say about coronavirus is when we saw coronavirus, at least in my living history, when it was in Hong Kong, when it was called swine flu, that died out after a while. So we may not need vaccinations every year long term, but let's just get over the next hump, and that's getting everyone their booster vaccine, which is our 3rd dose, and then watch what happens moving forward.
I've just booked my booster shot for the middle of next week, so I'll head into Christmas with that 3rd booster shot, and I have to say it was very easy to get it done. So getting straight back into our questions. This next one is from Eileen, and I think this will be for you, Anthony. Are neurological reactions caused by the immune system or spike proteins?
I guess it depends what neurological condition we're talking about. So there are some neurological conditions like Guillain-Barré, which are due to your immune system activating in a non-specific way against something in your body that it shouldn't. And that's not specific to the spike protein, because that does happen in other types of conditions, like getting Campylobacter, for example, so getting food poisoning. So it's a non-specific reaction of the immune system that targets neurological tissue. There aren't any to date conditions specifically related to the spike protein production, whether it be on the surface of cells. So it doesn't look to have any similarity with tissues in the body that sort of redirect damage to other parts of the body, let alone the neurological system.
Thanks, Anthony. Coming to you, Hina. This is a question from Kyle. And we were just talking about boosters before. Kyle asks, should I get the third shot now or wait for a new formula to deal with Omicron?
I would still get the booster now, to be honest, because that's what we've got available. That's the data that we're watching and seeing in the evidence from overseas. And we practice evidence-based medicine, and we're constantly recording and watching what is happening around the world with the different variants and with the different vaccines that are available. And so as we see the evidence change, then you'll see how we will respond to that. But for now, I would say, yes, get the booster at this stage.
And I'd completely agree with that, Hina. I would remind everyone that, remember when Delta came and people are like, oh no, it's not going to work for Delta. And then we found out, oh, it still works for Delta. And that may be the exact same thing that we find out for Omicron, is actually we don't go to hospital, we don't get severely unwell, and we don't die. And those are all really important outcomes of getting vaccinated and getting a booster. So definitely take your booster.
Thanks, both. And sticking with you, Anthony and Hina, a question from Bibiana. Are vaccinations safe for people who have long COVID? Will it cause a flare-up?
So no, it won't cause a flare-up of your long COVID. It doesn't tend to interfere with people who have already had long COVID. The one thing I would say is getting vaccinated decreases your likelihood you'll get long COVID, which has to be the goal of this, is we don't want you to have short COVID, long COVID, any COVID.
Nicely said. There's a question here from Ben. Hina, you might like to ask this, and we touched a little bit on this in some earlier questions, but he's asked, why can't healthy people just opt out of getting the vaccine?
Well, you can actually. That's the short answer. So it is your choice, to be honest. And I'm not going to go answer the questions about mandates and things like that, because that's outside of my scope. But it's still a choice, to be honest. So in my mind, you know, it's up to you to make the decision which is right for you and your whānau. But, you know, when you look at the evidence that we're seeing, who is affected by COVID, who is becoming sick and unwell, it is our vulnerable people, it is our Pacific and Māori people, it will be our disability communities because they're more vulnerable. And this is one of the tools that can help protect us and protect your whānau and keep you safe. So my short answer is that you have a choice, and if you're not sure, then as Dr. Hu and others have said, please talk to somebody that you trust who can probably walk with you and find out your reasonings behind maybe why you don't want to have the vaccine. But it is still a choice. But for me, the choice is that I believe it's safe and I want my family to be protected and the people that I work with. And so I would recommend to get vaccinated, but it is still your choice.
Thanks, Hina. And another clinical-based question from James. He says, I have hypertension, which is treated and managed. My work requires me to be around unvaccinated children. I considered quitting my job. How risky is it for James to be around these children?
Not very. I would encourage James to continue working with tamariki Clearly, it's a job he loves, and he's made the right decision about protecting himself by getting vaccinated. So he's done the best thing he can do. And as we've already talked about, there'll come a time where we're able to vaccinate our children as well, and that will help to prevent COVID having little outbreaks in educational facilities as well. So kia kaha, James, keep working, educate those tamariki, teach them about vaccines maybe.
All right, I'm going to move from some clinical questions to some other more general and practical questions. And gosh, Huhana, I think I'm coming to you for this one, which is, and it's from Ems, who asks, as a disabled person, I have experienced a lot of abuse from others who have not been vaccinated. How do I deal with this?
It's not easy. I mean, you and I know about abuse, Paula. We get it a lot being in the media and that. The best thing to do, I don't engage anymore on social media into any arguments with anyone that I detect to be an anti-vaxxer straight away. Keep yourself safe. It's really important. Sometimes it's just really not worth going there. We can't actually, if you go outside your door, you are at risk of non-vaxxed people because the wide world out there does not control, you cannot control it, but you can control your own home. So for me, when I have to go out, I don't go out very often at all now, but when I do go out, I wear a mask, I have a disposable, and then on top of that, I might have a pretty mask if I want to, and if it's too hot, I just have the disposable. And I socially distance, I contact trace, I sanitize, so I'm doing everything I can to stay safe. That's all we can do. Take responsibility for yourself. In the end, you cannot control what they do, what they say, and how they behave. What you can do is control yourself. So work on you, keep yourself as safe as you can, and in the end, their decision will have consequences. That's on them. You're not responsible for that. If you want to engage with them, then be prepared to have information and knowledge that you can answer how they respond. And if not, just walk away, wheel away, slide away somewhere, because it's really not worth going down that hole because it gets very nasty and gets very abusive. I don't go there with people. I prefer to say to them, that's your choice. And then I walk away or wheel away. And that really, we can't be responsible for other people. We just have to be responsible for ourselves.
Kia ora, Huhana. I think, we all sort of recognise that, there have been some behaviours that haven't been ideal, and certainly we don't want anyone tolerating abuse when it comes to the vaccine. And I think that, you've all given some really good advice and wisdom around listening to people, and that doesn't mean to say that people have to tolerate abuse, but I think if there's a way to have good conversations with people and really listen and try and understand and help them to make a decision and get access to information that they need to make a decision. We've this evening answered a number of questions that have come in live from people, and a number of questions that the ministry received prior to the event. I know that we have not answered everybody's questions, and I did note as they were passed to me that there was also some duplication of questions. The ministry will be trying to answer those questions that were not answered tonight, and information will be available on the ministry's website. But before wrapping up, I just want to quickly take a soundbite from each panelist about something you want to leave people who have been listening this evening. What are the key messages you want to leave people with? And I'm going to start with you, Jackie.
Excellent, thank you. Key message for me would be, look, if you're unsure and you need assistance, we can probably help you with getting there or finding the right site or giving you some information. We can take the time. We're not under pressure. So you take as long as you like, and we'll help you get to the right decision. So thank you for this opportunity.
Kia ora, Jackie. Anthony.
It's always best when you don't go last in these things because everyone steals the stuff you want to say. So I was like, thank God I got another Jackie. Choice is a really important thing and an amazing thing that we have in Aotearoa to be able to exercise. But like Huhana was saying, trust the science, the vaccination saves lives. And I really encourage you to talk to someone about anything that you are still on the fence about, want some clarification on. You know, we come on these things because, you know, we want to support you through that process. So thank you very much for hosting again, Paula. It's been a wonderful evening, and thanks to all the others on here tonight.
Thanks, Anthony. Dr. Huhana.
I'm not first or last for a change. It's wonderful. I guess for me, I'll talk about another friend that got COVID, and he was in hospital recently. He's disabled, fully vaxxed, and he said to me that he was the oldest one in that ward and all were young men, unvaxxed. He said he was the only one that got to go home quicker while each of them ended up in ICU. So for some people, yes, it is mild, but for some people it's far from mild. My daughter-in-law lost her father to COVID last year. We haven't recovered from that. You know, I've got friends with long COVID. I've got other friends in America disabled that were essentially killed by their senators because they refused them ventilators. We don't need to go down that road in Aotearoa. So, you know, let's have some common sense and let's bring it back. We are not America. We're not the rest of the world. We are the number 8 wire solvers of problems, and we can do that again. You know, if we really care about each other, as we often say we do, I care about you. I don't care what color you are, age, ability, nothing about that. What I care about is that you live here in Aotearoa, and I'd like to see you safe, alive and well. So come and join us, talk to somebody, make the decision that's right for you. In the end, only you know, but I hope it's the decision that is a good decision that keeps you well and alive. Thank you.
Kia ora, Huhana. And your final message for viewers, Dr. Hina.
I'm going to go full circle back to the beginning where I talked about my anxiety for myself, but also my community and the love of my job. And, you know, that vaccines are a fantastic tool that help us to, you know, support our immune system fight infection disease for which we don't have very good treatment for. Lockdowns were a really good tool, but we are all sick of lockdowns and we all want to get back out in the community and be able to, you know, see our whānau and our families. And, you know, so as I said, I got vaccinated so I can continue to work with my community, so I can continue to go out there. And so that's where I'm coming full circle is that, you know, we can't live in lockdowns forever. And so that was one tool that worked for a while, but we've got another tool available to us now that will help us to get back out there so we can come together as one big wide whānau safely. And so we can get back to some normality in the future. Thank you.
Malo, Hina. Well, it's been my absolute privilege to host this evening's session. And just a reminder that the panelists who I think have done an incredible job at trying to answer as many questions in a short space of time as possible. So joining me tonight has been Dr. Anthony Jordan, Dr. Hina Lutui, Dr. Huhana Hiki, and Jackie Marriott. I hope the information that we have given you this evening is helpful and enables you to make a decision to get vaccinated and protect yourself and your whānau. Remember, as it's been said, it's really important to get information from those you trust, those who support you. And the websites like Unite Against COVID and the Ministry of Health certainly can provide you with a wealth of information. Being vaccinated helps protect ourselves, our children, our whānau, and our community. And this panel this evening, I think, has really reminded us of the opportunity to make that happen together. Ngā mihi nui, kia koutou katoa, thank you, and good night.